Have you ever wanted to serve internationally but don't have a lot of time or money? Worried that you cannot be of assistance because you don't know the local language? Well, International Service Learning has a solution. Consider one of their many short-term service learning trips abroad where they will take care of everything from country arrival to departure. Choose from a wide variety of programs and an ever-growing list of countries with International Service Learning, where their motto is travel, serve, learn. The website's easy, internationalservicelearning.org. Thanks for joining us on another episode of the International Service Learning Experiential Education Podcast, where our goal has always been to share the voices of international service. I'm Dr. Patrick Hickey, or Dr. H, and it has been my honor to be the host of this podcast. It's another great day to talk about service, and joining us today to do so is Faith. Well, I'm excited this morning to have Faith with me, and kind of an interesting story. I was very privileged to have been invited to speak at both the mid-year and annual conventions for the National Student Nursing Association on the value of international service. And in addition to speaking, I was tabling and representing international service. And through both of those events, I was able to meet a lot of student nurses that were very excited about the opportunity, but only a few that had actually had the opportunity already. So Faith, who we have with us this morning, had already had an experience, so she very willingly obliged to join us today, and a lot of congratulations go out to her because she just graduated as a nurse, and she's real excited and getting ready for her NCAT or her NCLEX exams, which are coming up, and it takes a lot of studying and preparation. But before we get into your service learning, Faith, if you don't mind, just tell us a little bit about yourself, where you're from, what you've been doing in school, and what are your plans moving forward?
My name's Faith Bordenabe. I'm from northern New Jersey, Morris County, if anybody knows where that is. I went to Villanova University. I just graduated last Tuesday from their honor school with a degree in nursing and a double minor in peace and justice and global health. And after graduation this September, I'm starting as a pediatric oncology nurse resident at the Children's Hospital of Philadelphia.
Wow. Well, congratulations again on graduation. That's huge. Having taught in the
Thank
nursing
you.
program, I know the challenges. Tell us about that peace and justice and global health minor, I believe. Is that correct?
Yes. Yeah. So the programs actually overlapped a lot, which made it really possible for me to get it as a nursing major. I know it's really difficult, at least at my school, to get a minor as a nursing major. And actually, my service learning experiences, I had done the one that I'm going to talk about today in the Dominican Republic. And then I had done more of like an academic, less service-based one in Japan. And both of those programs were through the Global Health Department, which is how I got involved in that minor. And then a lot of my classes that I chose to do in the Global Health minor, such as like human trafficking, and this other course that was about starting protests or rallies in like an ethical and faith-based way, also were part of the peace and justice program. So my advisor was just really great and kind of introduced me to the advisors for both of those minor programs. And that is how I got involved in both of them.
Well,
and I really enjoyed both of them. So
just for people listening, it is very challenging to have a minor in nursing. Having been exposed to the program before. So kudos for graduating nursing. Kudos again for having the minor. And peace and justice and global health. How exciting. I mean, why did you go down that road? What intrigued you about peace and justice and global health?
To be so candid, initially my global health interest was purely the fact that I never really traveled prior to college. And I knew through getting involved in the global health department, they had these service learning experiences. And I wanted any excuse to travel. So that's what initially got me involved in it. And I think having gone on those trips and done those experiences, it, as we'll talk about later, showed me a lot of interest that I probably never would have come across if I hadn't done them. And I was really involved with resolutions and policy and SNAP. And after having done the service learning experiences, I started to kind of merge those two interests. And that is also kind of led me to peace and justice, because at least at Villanova, most of the courses in peace and justice are about like peaceful protests or peaceful opposition to like an issue. So I feel like that just aligned really well with the policy work that I was interested in. So that's kind of how it all happened.
Well, it's interesting that you share why you chose that path because it's basically it's a common theme when I speak to students. It's getting out of your comfort zone. In your case, you
Hmm.
hadn't traveled before, so it's kind of outside your comfort zone. So you chose this minor to push yourself out of that comfort zone, which is kind of great. Which I guess leads us to your service learning trip. Tell us about that experience.
So I went to the Dominican Republic fall of my junior year over our fall break, which is just a week long break in October. An interesting part of it, I thought, was that it correlated with our med surg clinical. So technically, it counted as like my clinical hours.
Hmm.
So I got 2 days off of clinical in med surg, which was really nice at the time. But it was kind of cool to see how, like, the systems were similar in the sense of like we were doing med surg work. It was very much very much very different disciplines and a lot of different patients that we were seeing, but it was in such a different setting than we were seeing at a hospital in Pennsylvania. Yeah.
So when you said you were doing med surge, I mean, were you doing vital signs,
So,
doing health assessment?
so the way that the trip was broken up was that there were, I think, 12 students who went on the trip, and they broke us up into stations every day. And there was a station that was vital signs, a station that was more organizational, like guiding people towards different parts of the clinic, um, a station that did deworming for kids,
Hmm.
a station that got to listen in on the doctors. We had doctors, eye doctors, and dentists. And so there was a station position that was just listening in, which was primarily for students who spoke Spanish, obviously, because it was all in Spanish. And there was also the biggest one was the pharmacy. So we had brought and also had at the church that we were working with a bunch of meds, but they were primarily like unlabeled and unorganized. So the first night that we were there, we stayed in a local church that was partnered with the clinic that we were working with. And we literally sat on the floor for, I think it was 3 or 4 hours, just organizing meds into tiny little bags, which was also like a farm review in and of itself because you had to like put the meds and then what they were for and what the usual dosage was. And then when you were working the pharmacy at the clinic, you sometimes would have to like change the dosages or like change what the instructions said. So those were the big like stations that we would work in.
Now, what was the typical day like? So those were the stations. What was your day like when you went to the clinic?
Yeah. So, like I said, we stayed at a local church. And so every morning we would get up and translators, the doctors that worked in the community that were working with us, all of them would come and meet us at the church. And this is just like a fun fact, but the nuns at the church would cook us breakfast every morning
Hmm.
and then also would pack us lunch. And then when we would come back, would make us dinner and get us a cake. And it was so nice. It was like
Wow.
one of the highlights of the trip that wasn't related to the actual service learning part, just because it was always so exciting and we would like guess what flavor cake we would get. But either way, so we would do that. We would all meet up, we'd get together. Usually they would pray before we would leave. And then we would take the school bus, usually like 2 to 3 hour drives. They were very long to very remote parts of the Dominican Republic, like through so many fields. Definitely a different view of the Dominican Republic that I feel like most people get when you're going on more of a tropical
Hmm.
vacation. We were like hours from the beach at most points. So we'd do that. And then we would arrive at, they were called bateyes, and they were sugarcane worker fields and communities. And since they were so remote, they were pretty isolated. They weren't really leaving their own community. They didn't really have access to much of the resources that were in the greater part of the Dominican Republic. And obviously, one of those being healthcare. And something that we noticed is most of the patients that we were working with would have the same like Ziploc bags and resources from the last time that clinic had gone out there. And they would have been just like making it work up until the clinic came back out, which was definitely like hard to see because it was something that isn't an easy fix and isn't something that we, in the experience that we were doing, could really create a sustainable change for in that exact moment, which I think, especially as nurses, we kind of like a little bit of like instant gratification of like, oh, you don't feel good, like I will help you with this, or like,
Mm-hmm.
oh, you need this, I will get you that. So it was definitely tough to be in an experience where this was more of a general healthcare issue and access issue.
It
And
is
that
pretty.
takes a lot more.
I was going to say it is pretty amazing when you're the only health care that these people have. When you said they were waiting and had the bags from the previous healthcare group, and
Mhm.
access to healthcare being such an issue, so nice that you were able to go to them and traveled so far, and they were so
Yeah.
isolated that you were able to provide that care for them. What was it like working with the local healthcare professionals? I'm sure you mentioned a few of the different doctors and probably pharmacists that you had. What was that process like?
It was really cool. My family's from Argentina, my dad is at least, and so I do speak a good amount of Spanish, so I got to chat with them too on the buses to and from, or also just if there was a downtime in between patients. And I also was one of the students that was able to listen in on their conversations. And I thought it was really interesting. Their medical schooling program is very different from ours in the sense of it's a lot shorter, but very similar in what sounds like stress and like workload, just in a shorter capacity, which they were saying they think is because they have such a need for healthcare out there. But yeah, and a lot of them were doing the program completely just as a volunteer program. It was associated with the hospital where they worked as physicians, but they weren't getting any compensation or like special benefits for doing this. It was truly just out of wanting to do something for their community, which I thought was really
Mm.
special. And at the time, also, that I had gone to the DR, they were, I mean, they've been in a conflict with Haiti for quite a bit, but there were a lot of Haitian people as well within the bateyes, and there were sometimes struggles with people feeling scared or nervous to come out
Mm.
to us
Right.
because they didn't want to be deported or anything like that. And so it was interesting to hear the healthcare professionals kind of like soothe community members and like
Mm.
encourage that they were there to help. This was truly just like a community effort.
What were the top two or three medical issues that you saw?
Primarily blood pressure, hypertension. I remember my friend and I were at the vital signs station, and she had taken a man's blood pressure and she finished it and she tapped me and she was like, "Can you take it again?" And I said, "Yeah, what'd you get?" And she said, "I don't even want to say because I think I just have to be wrong." And they were numbers that truly we see patients with hypertension in the US all the time, but these numbers were just numbers I hadn't seen
Mm.
before. And that was a big one. And a big thing that we noticed with inpatients with hypertension was that they would have blood pressure medications from the last time the clinic came out, but they weren't taking them at the schedule they were supposed to because they were trying to make them last until the next clinic,
Mm.
or they didn't know when the next clinic would be. So that was the primary one. And then there were a lot of dental issues.
Oh.
The dentist, every time that we had the dentist with us, was doing a lot. And it was also definitely the hardest station to watch because, I mean, we had resources. Definitely, we were bringing resources, but we also were in set up churches in a makeshift clinic. There's only so much that they have. And so it was a lot more, trying to think of the right word. I feel like gruesome is a harsh word, but
Mm.
gruesome to watch than the regular dental cleaning. And I personally think regular dental work is also gruesome. So yeah, those were the two biggest things that I noticed.
What of all the patients that you saw during the time there, was there any specific patient or community member that stands out?
Yeah, so on the last day, we actually weren't out of Batey. We were in the city that we were in, La Romana, and we were in a church still, but it was just more in the center of the city. So it was more people that just weren't in the sugarcane communities, but still struggled with access to healthcare. And there was a woman who came in when I was doing vitals, and she was like, "Oh, you speak Spanish. Like, can I practice my English with you? Like, I work
Mm.
at one of the resorts in Punta Cana. I'm a waitress there." And I was like, "Yeah, of course." Like, I was practicing my Spanish. She was practicing her English. And we were just talking about her life, like her family, etc. And she had said her family lives in La Romana, but she works in Punta Cana, which are not close. I realized as we were talking. I don't remember exactly how far they are, but it's a couple hours. Like it is not down the street. But she said that with the insurance that she gets from her job and the resources she gets from her job, this clinic is the only place that she can get healthcare.
Mm.
So every time that she hears it's coming, she makes the trek back to stay with her family for the night so that she can come to this and get her healthcare. And I feel like that really stuck out to me just because it made me realize how different access is there versus here. I mean, especially for me personally, this was my first service learning experience. I'm from northern New Jersey, near New York City. There's a doctor's office every time you throw a pebble. Like, it's a very, very different experience to access. I had never thought about traveling hours to stay with your family to go to a clinic that you're then going to wait for hours because the line is out the door just to get like a basic checkup. And I think that was really a stark realization for me.
That's
So
quite
yeah, I always
eye-opening.
remember her. Yeah.
That is, I mean, for her to be employed, to travel that distance, to stay with family, just to take advantage of the healthcare resources. That how when you compare to the United States, I mean, access to healthcare is an issue, obviously, in the United States also. But
Yeah.
what does that experience that you just shared? How will that affect you moving forward when you're working with underserved patients?
I think it really emphasized the importance of listening and also not assuming that you know the backgrounds that people come from. One experience, especially that always sticks with me, is I was translating once because they let us, we had professional translators that helped translate meds and such. But especially for more simple meds and simple, like one medication patients, they would let students who spoke Spanish do some translating. And I remember I was translating with a patient. It was an older man. He was probably like, he was 85. And he just had one med. I don't even remember what it was, but it was in a bottle. And I had said in Spanish that you need to take one a day. And I held up the bottle and I like shook it. And one of the translators came up to me and he tapped me and he said, "You are technically right. That's correct Spanish. Like, you're right. But you have to say the entire process of you have to open the bottle, take out a
Mm,
pill, and take the
mm.
pill. Because I know for a fact that if you ask him right now, he thinks that you need to take one bottle of
Bottle of
pills a
pill.
day
Okay.
because
Yep.
he's just like not used to hearing medication prescriptions. He's not used to
Correct.
taking pills. He doesn't
Correct.
know that you mean one pill
Well,
unless you say one pill inside.
that was a very good lesson actually. So
Yeah.
you should have said tomo una pastilla cada
Yeah.
día. Take one pill per day. But I mean, culturally, that is a very important lesson because, and I shared before, there was an old Grey's Anatomy episode many years ago where they were dealing with a Hispanic patient, and the nurse at the time said to the patient, wrote down the instructions, and it said, take once a day. And as you know
Hmm.
Spanish, what's once in Spanish?
11.
11, and you made for TV, but the patient took 11 pills because they saw it as once.
Yeah.
So, yeah, I mean, I'm really glad you brought that up because that is a very important lesson that when we're working with an underserved population or those with what we call limited English proficiency, that we've got to be very careful when we're giving instructions
Hmm.
because there could be misinterpretations. One of our clinics, we had a student was discharging a patient and was giving him the discharge instructions, and he was having a hard time understanding, and she thought maybe he was illiterate, but it was actually he couldn't read. He didn't have glasses. So we provided reading glasses at our clinics to help them. So you never know where they're coming from as far as their
Yeah.
literacy, their health literacy. So that was great that they took you aside and shared that with you that you really need to say take one pill a day instead of taking the whole bottle.
Yeah.
And you know the other thing you shared earlier about the important thing of listening that's so important, and that's come across in a lot of the podcasts. If we take the time to listen to our patients, because you know in the clinics where you were, you probably had the time, but once you start working in our healthcare environment, it's going to be go, 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 rush, rush, rush. My experience after 50 years of nursing, mistakes happen when we're pushed and when we run. So, if you use that mentality of what you had in the clinic settings down there, take your time, listen to what they're saying, and then not be pushed too quickly, because when we rush, that can lead to errors.
Sorry.
No, no. So, what was your experience with you said it was kind of sort of similar to a med surg experience. Did you feel that when you came home after the clinic experience in the DR that you were much more comfortable working in the clinical setting as a student nurse?
I definitely think I was more comfortable in the clinical setting for sure. I think it was it was so hot in the
Mm,
DR. It was so hot. There were a lot of bugs. It was a very different situation than I had been used to in the past. It's very different for me in a hospital. And I think it kind of forces you to have more conversations, not only with the patients, but I was also talking to the doctors more. I was talking to the translators. So I was engaging in more conversation about healthcare. And I think having that experience made it easier for me to come back to a clinical setting in a hospital and feel like I could talk about healthcare. For us, med surg is our first real clinical too. So I came back to my first real clinical experience. And I think having that international experience kind of gave me a little bit of a leg up in my comfort just in that sort of environment. Yeah, and I think too, even just the meds, like I said, it was a little farm review every time that we had to put meds into a bag
mm,
because obviously our professors would be like, what is that med? What is it for? Like, you can't give, even if you didn't speak Spanish and you weren't the one doing the translating, you had to tell the translator what the prescription said and answer any
right.
questions. So it kind of gave you more of a perspective on that as well, I think.
Now, you're probably more in tuned to global health because of your minor and your personal interests, but what do you believe is the most sustainable, impactful way that students can contribute to global health, or even nurses?
This question, I like have sat with this question because I'm honestly, it's such a heavy question. I feel like there's so many different ways to answer it. But I think the most sustainable and impactful way to contribute to global health is to honestly, genuinely just listen or be comfortable being taken outside of your comfort zone. There was this one girl on the trip that I went on, and everybody on the trip had kind of like gone with a friend, if you know what I mean. Like everybody had
Mm,
kind of, me and my friend were going on this, whatever. And there was this one girl, and she just went. She was like, she was from Connecticut. She was like, I've only ever been in Connecticut until I went to Villanova. Like, I really haven't seen too much of the world, particularly. I haven't had many experiences with people of different backgrounds. Like, I want to do this and I want to learn. And she went, and she didn't really
mm.
know any of us. And now we're all actually really good friends with her, which I feel like is a good lesson on also it's totally worth the experience. And even if you don't have a friend to go with you, you should go. But also from the global health perspective, being like her and being willing to just try something and to listen to other people and to do an experience that's completely outside of your comfort zone, even if it's not international and it's being in the hospital and working with a patient from a different background or that needs a translator, being willing to actually do it, I think is really important. And understanding that even if you think you know a lot about a certain background, you might not. Going back to that story with me and the pills, like I had heard people speak Spanish throughout my life and such, and I thought that I knew how to say something in Spanish, but I wasn't from that culture. I wasn't from that place. Like there are differences. And I think understanding that and being willing to accept that and hear that is really important.
Well, I think all of our programs probably prepare us a little bit for culture. I mean, in my nursing program,
Hmm.
I used to teach some of the courses. I don't think it really adequately prepares you for the patient population that you're going to have.
Yeah.
But as you said, the more that you get out of your comfort zone, the more that you actually step out and go to another country, or if you can't afford it, looking in your own backyard and finding maybe a Hispanic clinic or something where you can get
Hmm.
some exposure. By pushing yourself a little bit, it endears you to that local population. And it helps you to have a better comfort level when you're dealing with people, in this case, maybe that have limited English proficiency. Knowing a little Spanish goes a long way, but probably more importantly is knowing your resources. Because
Hmm.
what I've seen is more and more patients are being discharged earlier and earlier than they used to be from the hospital setting to recover at home, and then having to depend or utilize resources in their community that they may not be aware of. For example, durable medical equipment. If you need a walker, if you need a portable toilet, if you need a special bed, I mean, those things are all available in the community. But when we work in the hospital setting, we may not be aware of those resources. Our discharge planning nurses may be more aware than we are. But the more you know your community, the better advocate you can be, I guess is what I'm saying, as a nurse. So you've kind of sort of already answered it, but for students like the one you just described that are considering a similar trip to what you had. They may be on the fence about the cost. I don't know, this might be a little expensive. They may be a little concerned about the culture or the fact that they don't speak the language of the country they're going to. How would you help them to prepare for that experience?
I would say, especially in terms of costs, especially if you're a student nurse, I am a scholarship kid through and through. All of my experiences are on scholarships. And I have noticed that, especially for global health and international service experiences for nurses, there actually are a lot of scholarships out there. I had some through my university, but also just online. Like I had said earlier, not only is it hard to get a minor as a nursing student, it's quite difficult to do abroad experiences or any service learning experiences. It's just kind of hard to work into the curriculum through your school. I mean, so there are a lot of scholarships out there and there's a lot of resources out there. And I totally recommend that if you're interested, looking online and looking to see maybe what you qualify for scholarship wise. And then in terms of the culture and maybe not knowing the language, that same girl too, I remember, didn't know any Spanish, and on the bus to one of the bateyes one day, she came up to me and my other friend who spoke Spanish, and she said, "Guys, I have to do vitals. Can you just tell me how to say, like, hi, I'm gonna take your vitals. Like, what arm do you want?" And we were like, "Yeah." And we told her, and we went back and forth, and she like practiced on us. And then throughout the day, she just did it. And obviously that was all she knew, but she said multiple patients had said like thank you basically, that she was even trying. And I think especially when it comes to learning languages or like learning about something that's outside of your comfort zone, it's really easy to assume that everybody is going to judge if it's not perfect at first.
Right.
But especially when you're traveling somewhere else and you're there to help and you're there with good intentions, like people are happy to see you try, I think.
Oh, I totally agree, and I'm glad you brought that up because I try as best as I can in my broken Spanish, and they most of the time the people said, "Oh, usted habla bastante español," and I respond, "Oh, I said muy amable," very nice.
Hmm.
Thank you for the compliment, but it's not the best, but I do try, and I agree with you as long as you try. The scholarship piece that you address, I agree. I always, always, always encourage students to apply for as many scholarships as there are out there. For example, International Service Learning on their website, they offer, some scholarships. There is a lot of money available, and a lot of times your own university has it. And then the experience you described with the student, wanting to have you share a little bit of Spanish with her. One thing you learn on these trips that you don't think about is you develop collegiality, you develop teamwork, you develop a united front because when you start working as a nurse, which is coming up very soon for yourself, you're not a nurse unique to that unit. You're part of a team, and you've got to be able to work together. And the fact that you work together in a clinic in an underserved area where the conditions weren't the best, as you described, if you can work in that condition, hopefully you should be able to work in a condition back in the United States in a hospital setting. So I guess that said, the values of an international service learning trip, we could go on and on and on, from collegiality, teamwork, learning cultural assimilation, developing a respect for another language. And I mean, you didn't say anything about the foods, but you tried their foods.
So good. It was great.
most of the time they are very, very good. And it's something different. But again, the whole theme here has been stepping out of your comfort zone. Well, I appreciate you sharing that. Is there anything else that you would want to share about your service learning trip and how that's affected you with what you're doing now and what you're doing moving forward?
I think in general, I would just really recommend it to anybody, especially if your school gives an opportunity to do so. Obviously, as well as finding it outside of school is great. But I know at my school, the opportunity was there and a lot of people didn't do it. And then later on, as we just graduated, had mentioned towards graduation, like, oh, I wish I had done that, or I wish I had tried one of those experiences. And I think no matter what, like, as a nurse, you want to help people. You want to help people with their health. Like, that is why you do what you do. And in the end, whether you're doing it at a hospital near you in your clinical or you're doing it on an international service learning trip, that is what you're doing. So don't be afraid to do it. In the end, you're doing the same moral. So just give it a shot. And worst comes to worst, if it's not for you, then at least you have that experience and you've seen a different side of healthcare. So.
Well, Faith, I appreciate that. I appreciate that you said if your school has an opportunity, take advantage of it. And the reason I bring that up is I just interviewed a faculty member from the University of Maine just recently for the podcast, and I asked her, how did your course start? Because she had a course on international healthcare. She's led, I think, 15 plus trips. I said, how did it start? She said it started because of two students in her school came up to her and said, we would love if the school had a course on international healthcare. So it was student driven. They didn't have a course. They didn't have anything set up. So it was two students in her school many, many years ago that came up and said, can we do this? And she said, I don't know. Let me find out. Because of those two students, she put together a course that has affected literally hundreds and hundreds of students and thousands of patients, all because of two students' interest. So I share that because you said if your school has an opportunity, go for it. But some schools don't have the opportunity. So I guess what I recommend is if you don't have an opportunity, but you've heard what Faith has said about the value of a trip, go to your faculty and say, hey, I heard about this student nurse who went on a trip. Their school had an opportunity. Our school doesn't have it. How can we make that happen?
I agree. I'll also say, I know, because I know this at Villanova specifically, this has happened. We've had service learning opportunities in the past for nursing that didn't have enough interest and then didn't run because they didn't have enough interest.
Mm.
So even more so, I think everybody should give it a shot. And then, if you have that experience, then you can recommend it to other people down the line. And maybe the things that you were nervous about, you can calm the nerves of somebody else that's interested and has that same concern.
Now, Faith, one last question. Yours was faculty led, is that correct?
Yes. Yeah.
Because you can be on a faculty led trip, or as a student nurse, we've seen a lot of cohorts of student nurses that will go on trips, and it only takes two or three student nurses. So,
Mhm.
there are a lot of providers out there, international service learning being but one of many, but do your homework and do your research. So if your school has a program and it's faculty led, that's huge. And that's what my trips were. I was faculty, I led the trips. But what I see now is a lot of students will get together and they'll pick a spot, Belize, Costa Rica, Guatemala, and they'll get two or three friends together and they'll go without faculty, which is totally fine because the structure of the programs in country is such that they will guide you through the processes. So you have options, whether it's a faculty-led option in your school or going as a cohort of student nurses on your own and only two or three. So many options exist. Well, thank you for sharing with us your experience. I'm hopeful that someone that's listening today is kind of sort of maybe on the fence and they've heard what you shared, and maybe they'll be like that unique individual that you shared that had never done anything like that, stepped out of her comfort zone and went on the trip, and she's a much better person, I'm sure, for it, as you are. And one last thing, share with us, you shared with me offline, share with us where you're going to be working.
Oh, I'm going to be working at the Children's Hospital of Philadelphia in oncology.
Wow, that's I'm so proud of you and amazed.
Thank you.
I can hear your passion. I know your future patients are going to be very, very blessed to have you as their care provider.
Thank you.
Well, thanks again. I appreciate your time and I wish you the best.
Thank you.
I want to sincerely thank our guest, Faith, for her willingness to join us on the International Service Learning Experiential Education podcast. But most importantly, I want to thank Faith for the passion that she has shared with us today. I'm certain that Faith will continue to be an advocate for those in international settings that need a helping hand, and undoubtedly will be able to utilize her Spanish-speaking skills in her local clinical settings to help those with limited English proficiency.